In today's video, nurses and other frontline healthcare staffs are being laid off, and we are going to discuss it in this video, so make sure you stay tuned for all of the details. But before we begin, as always, welcome back, everyone. So very happy to have you back for another update. Now let's go ahead and get started. Hospitals and long-term care facilities throughout the United States are laying off nurses and other frontline healthcare staff. And we are starting with Providence, which operates in 7 states, and they recently announced a significant restructuring effort that includes the elimination of 600 full-time positions in Everett, Washington. Over 100 certified nursing assistants, nearly 1/4 of the CNA staff, received layoff notices effective July of 2025. And Providence has cited increased operating costs, insurance payment delays, inflation, and expected cuts in federal reimbursements as the primary reasons for the staff layoffs. While the organization also notes that registered nurses RN hiring remains steady, and the reduction of CNA roles may place additional demands on existing clinical staff. And we are moving on to U.S. San Diego Health, laying off about 230 employees in June, including nurses, aides, and social workers. Staff and the California Nurses Association have raised concerns about potential impacts on patient care as well as staff well-being. Hospital leaders cited financial pressure and reductions in federal funding, but maintains that nurse-to-patient ratios remain in compliance with California state requirements. Next, we have Cleveland Clinic, a global leader in academic medicine, announced the elimination of 114 jobs in 2025, and that includes a mixture of administrative, non-clinical support, selective clinical support, and IT positions. The organization emphasized that the direct patient roles are largely unaffected and that active hiring continues in high demand clinical areas. Despite the layoffs, Cleveland Clinic remains focused on expanding healthcare access. Also on the list, we have Kaiser, 42 RN positions cut in outpatient departments. Mayo Clinic, Minnesota, layoff notices issued to more than a dozen nurses. And Memorial Care, Long Beach, California, 115 jobs eliminated earlier this spring. And finally, Peace Health Pacific Northwest, 250 roles cut, spanning nurses and other support staff. And hospitals are reporting a mix of economic and logistical challenges that are the cause for these layoffs, including decreased Medicare and Medicaid reimbursement rates, delayed insurance payments, rise in labor supply and operational costs, as well as broader inflation and related financial pressures. And as a result of these layoffs, these changes may lead to expanded responsibilities and increased patient loads, rising concerns about burnout and quality of care, meaning you and I will be directly affected because of these layoffs. These are unprecedented and scary times that we are living in right now. I pray for all of the nurses that have been laid off, and may change come very soon. Don't forget to share the video, subscribe, hit that notification bell, and come back for more updates. Bye-bye.